Everyone, now it's time to listen like your lives depended on it. Because in a way, they actually do. We're talking about health and wellness here. And so in a moment, we're going to invite up some really brilliant, innovative, visionary minds in the health and wellness space across different sectors who have some great perspectives. And they've got the crystal ball in terms of what's next. So we're going to learn about that. But it's my pleasure to introduce our moderator. And I was telling her before that we can't do a health and wellness event without her leading the conversation. So I'm honored to introduce Dr. Suzet McKinney. And she is a nationally recognized public health expert. She was most recently the principal and director of life sciences at Sterling Bay. Before that, she was the CEO of the Illinois Medical District. Before that, public health leader for the city of Chicago. And really is nationally known for many things, but in particular, health equity and also climate-related emergencies. So please welcome Dr. Suzet McKinney.
Thank you, Luke, and good evening, everyone. So my job tonight is going to be pretty easy, I think, but we want to make this an interactive session. So I'm going to start by introducing the panelists, and we'll have each of them come up as I call their names and read a short bio. But I just want to give you fair warning that there will be some audience participation as a part of our session tonight. So hopefully you're looking forward to that. So our first panelist, we're going to start with welcoming Luke Saunders to the stage. Luke is the founder and CEO of Farmers Fridge. Farmers Fridge was named one of Time Magazine's best inventions, and Luke was selected as one of Fast Company's 100 most creative people in business. So welcome, Luke, everyone. Next, we have Alyssa Jaffee, who is a partner at 7 Wire Ventures. 7 Wire Ventures has raised over $500 million focused on digital health. And Alyssa serves on the boards of Transcarent, NOCD, and 6 other health tech startups. Welcome, Alyssa.
Thank you.
Next in the lineup tonight is Anil Saldanha, who's the Chief Innovation Officer at Rush University Medical Center, responsible for AI, digital care, and innovation at one of top U.S. healthcare systems focused on patients, education, research, and community partnerships. Welcome, Anil. Our fourth panelist this evening is Kevin Cureton, who is the CEO of Solésence. Kevin leads this NASDAQ-listed, fast-growing startup that is pushing the boundaries of skin health across the globe. Welcome, Kevin. And last but certainly not least is my good friend Stephen Collens, who is the CEO of Matter. And in that capacity, Stephen oversees the city's leading healthcare innovation hub, supporting over 1,000 startups, corporations, investors, and ecosystem partners since 2015. Welcome, Stephen. So we have a lot of material to get through tonight, so I'm just going to jump right in. Starting with the global wellness economy, which is forecasted to surpass $9 trillion within the next few years. So let's start there with thoughts from each of you in terms of, do you think we're actually getting healthier, or are we just spending and buying more around the promise of health? So Luke, I'm just going to start with you and go straight down the line.
Okay, I don't have any data on this that I hope everyone's eating more salad, so that's probably a move in the right direction. But I think it's probably like a lot of things. It's a barbell in the economy, and so there are certain investments that you can definitely make, whether that's exercise, eating better, medicine like GLP-1s that you can take that are still relatively expensive, that are probably helping groups of people that can afford those things to get healthier. And then on the other end, where you can't afford those things and you're eating more fast food and can't get exercise because you're working 2 shifts and all that stuff. So that would be my bet, but I have no data to back it up.
I think that's good for not having any data. Alyssa, what do you?
Yes, well, first, thanks to Farmers Fridge, I'm eating more salads in the airport. So thanks, Luke. It's interesting as we think about longevity, there's so much hype on what I'll call the tech bro biohacker. which really isn't about health. And where we focus in healthcare, it's about not increasing your lifespan, but your health span. And I think in this country, we've done a pretty good job over the past couple of decades increasing lifespan. But we've actually trended in the opposite direction on health span. People now have multiple chronic conditions. We have a population that's having a very hard time as they think about aging. We are not supporting aging in place in the right ways. And while people are living longer, they're not living healthier. And so that's really, I think, a mission of many of us is to think about that notion of health span and what can we do, and all of us do, for our own lives, the lives of our families, of our loved ones, and of the community that we service in order to do a better job of health span.
And probably quality of life alongside health span.
Absolutely, absolutely.
Anil, your thoughts?
I think I'm going to say it's complicated. That's my favorite word. Because every person commenting on some aspect of healthcare is just looking from their perspective. So it's very complicated, let's put it that way. The positives are like people are informed, right? You had Dr. Google previously, now you have some version of AI bots, whatever, right? So it's a good thing in my opinion, right? But if people take like bad actions because of some bad advice, of course, but in general, people are like taking good care of their health. They're more informed. So, it's a good thing that there's a lot more billionaires getting into healthcare because health affects everybody, right? So it's really positive in that way. But just on the negative side, I want to say, because I get a lot of vantage into some of the challenges in healthcare. Up until in recent times, uncontrolled hypertension or cardiovascular issues were like the leading cause of death and diseases in the world and also in the US. But what we are seeing or hearing is by next year, cancer is going to be the leading disease in the US. And the number of subtypes, I mean, you get a couple of oncologists to talk to each other. It's like bots talking to each other. You have absolutely no idea what they're saying. So I'm talking about oncologists. So that's the complexity of cancer. And it's changing. But also, from a healthcare perspective, I'm really confident that we're going to conquer cancer or aspects of it. And I'm happy to dive deep into it. I just wanted to say, like, cancer is going to be a leading disease soon. And and I'm sure, on a personal level, your colleagues, friends, family, you are experiencing some aspect of cancer. So yeah.
Thank you for that. Sobering. Kevin.
Thanks, Anil. I'll bring it up a little bit. Cancer is a concern, definitely. And what we do, we're in the skin health business, and specifically to prevent cancer. We're in the SPF infused beauty business, so all of those, hopefully everyone got a sample or multiple samples so we don't take those home. But those products are really SPF infused beauty products. You'll wear them, you'll enjoy them just like you would wear and enjoy any skincare product. And what's the point? The point is that way more people will do the work of protecting themselves without doing the work. So in our industry, what we have seen is an increase in SPF-infused products, specifically in the United States. It is one of the fastest growing areas in beauty, and therefore I would say generally behaviors are such that people are getting healthier and are embracing wellness.
I actually love that because I think more and more as we can take control of our own health and not depend on others to just tell us what to do all the time, I think the better off we will be in many respects. So I appreciate your thoughts. Stephen, you see so much every day with all of the members that matter. What are your thoughts here?
I would love to be able to say that we're getting healthier. We are not getting healthier as a population. We are more obese. We eat terribly. Mental health is horrible. Chronic disease rates are up, and there's pockets, and there's a lot of technologies and a lot of innovations where we could be getting healthier, but I think the problem is a lot of the health and wellness stuff kind of exists over here, and then there's the healthcare system that exists over here, and they don't intersect with each other almost at all, and so it's hard for people. It is too hard for people to be do the things and make the decisions that are going to allow them to be healthier. Like if there was a farmer's fridge in every single office, that'd be amazing. And thank you for the sunscreen, by the way. I'm excited about that. And yeah, I mean, there's lots of technologies, there's lots of innovations, there's lots of solutions, but it's just too hard for most of the population to. The default is not to navigate towards the things that are going to keep us healthiest as a population.
So as a follow-up to that, Stephen, and we'll stay with you, what do you think is the role of innovation when it comes to personal health and wellness?
I think that technology has the ability and will increasingly result in more and more solutions and a greater and greater ability to keep people healthier and to encourage wellness. But again, I go back to this sort of system integration issue that we just see over and over. So Suzette mentioned we've incubated more than 1,000 companies, and one of the big challenges is that the hardest part of building a company that can improve health is not usually building the technology or the solution or the system that can be used to improve health. It's doing that in such a way that somebody's going to pay for it. And so my favorite example of this is a company it was started by a gastroenterologist. He sees a lot of patients with inflammatory bowel disease, which can be very catastrophic for people. And he wanted a system where he could monitor his patients instead of once a year when they show up in his office, that could monitor them in real time. So he built this thing, it sends them a text message every 2 weeks. They fill out this very simple questionnaire. Like 95% of his patients respond. He ran a study of that system with Blue Cross Blue Shield of Illinois with hundreds of patients. And the patients who were on it, hospitalizations went down 50%, the total cost of care went down 25%, because he could see which patients were most likely to deteriorate before they had any idea that it was going to happen because of the information and the algorithms. And so then he built this thing, it works, he goes out to try to sell it. Well, hospitals aren't going to pay for it because it reduces their revenue. The insurance companies were interested in theory, but for the most part, they have to make decisions on what they're going to integrate and what they're going to prioritize and how they're going to work across the system. And so that was like running into a brick wall. And 10 years later, the company is still progressing, but very slowly. And so until we fix that problem, I think we're going to be stuck in a little bit of a cycle.
Maybe just I think to Stephen's point, I like to joke that in healthcare, if you build it, they won't come. And so, often there's many entrepreneurs in the audience, and as you think about, there's so many people want to come to healthcare because it's so enticing. We have enough problems to last us a lifetime, and we're all consumers of health. And so no one wants to be a patient, right? Patients are people that have things done to them, and consumers are active stewards of their health. And so they come and with this vision of saying, hey, I know this is a problem. I felt this problem. I've seen it, but not understanding the intricacies of the incumbency. And, one of the things that we look for is we invest, against $500 million on a thesis we call the informed, connected health consumer, right? How do we help people to be better stewards of their health? It's unlocking those incumbent dollars. It's really thinking about day one. That is, most people in this country cannot pay out of pocket and are not the billionaires doing the crazy things, but really are somehow connected into the system, whether it's the government, whether it's employer, whether it's the exchanges. And so understanding how the payment flows work is so transformative when you bring your innovative solution to that.
I think part of the lesson there is that healthcare is also big business. And in many respects in this country, we are in the business of not necessarily helping people get healthier, but rather keeping them sick. So that's why everyone in this room is so important. having the mindset and the mission to want to innovate, to help us all improve our own personal health. Anil?
I want to throw a axe or wrench into it.
Okay. Just don't bring us
Neil's really
down.
here to lift our spirits.
So if you look at the progression of like what the feds do in healthcare, it kind of clearly indicates like what are the challenges and where you should be going. So in recent times, for example, CMS, the largest insurer in the US, right? They come up with so many innovative payment models. One of them in recent times is called Access. And that's primarily requires like digital infrastructure to be laid out, and you get like payments based on that. And the entire premise behind value-based care is you get paid if you keep people out of hospitals, right? So that's the North Star or whatever. But the entire industry is not built for that. But we should be aiming to go towards that, right? That's like an ideal situation. But there is like major, like I would say, impetus or like, at least encouragement coming from the feds. If you look at CMS payment models, they're trying. I'm not saying they're successful. The industry is built really complicated, basically. Yeah.
So I think this is a good time to go to the audience for an audience question. Are we doing show of hands, or do we have a poll up there? Okay, great. So this is where we get a little bit interactive with our audience. And so the question for you guys is, which of these areas would you most like to see transformed by innovation? Your choices are diet or nutrition, exercise, sleep quality, mental health and stress alleviation, or helpful technologies such as wearables or apps. Wow.
So far, this
Okay,
is
we're
my
almost
favorite
there.
audience poll technology, where you see the thing like scrolling.
Yes.
Like, that's cool.
It's very cool. So we have almost 100% participation. We'll go another couple seconds to let everyone get their responses in. But while that's happening, I would ask the panelists to, just take a look at the results so far. And my question is, well, first of all, would any of the panelists like to respond to the results that we're seeing here? It looks like it's pretty much a tie between diet and nutrition and mental health and wellness. Go ahead, Alyssa.
Well, I'll respond from, I love this because the audience is answering this as a consumer of your needs and how you think about your own life and innovation. And diet, I think many of us, and Luke can speak to this more than any of us, but the impact of how choices and daily choices on diet and nutrition come into play. What I'm most interested is sort of this, the notion of mental health as we think about behavioral health, particularly on the acuity scale. This is actually where innovation has so much ambition to transform the industry. And today, there is a lot of gatekeeping on mental health services. There are some now telehealth companies that have started in the lower acuity space, but we have a company that's in higher acuity and complex psychiatric conditions. It's called NODO. It used to be called NOCD. They offer treatment for obsessive compulsive disorder, for PTSD, panic, anxiety, etc. If you want to go see an OCD specialist, Rush has some incredible specialists. I imagine their wait time is 6, 9, 12 months, right? They're inundated. And so before innovation happened in telehealth, you couldn't actually do that. So then we started to bring therapy online. But what did that start to look like? Well, that was really one-to-one. But what happens? You're not spending your whole life sitting within the four walls of your clinician's office. 99% of your life, you have to live your life. And so what are the tools and resources that we can provide in order to help equip you to focus on bettering your health and focus on your mental health? And so then we started to see all these really interesting tools that these companies were coming up with. And Again, those sort of in between gamified ways that would get people to actually engage and involve with it. And now, I mean, these companies are doing such incredible things. They're using AI to create digital twins of providers and patients to train providers to have better outcomes based on real data that they have. And then they are taking that outcomes data and they are going to the health plans and saying, you pay us more money because look how much money we are saving you because of the betterment of society. So for me, I'm so excited to now, officially that's number one. I'm excited to see that because that is, as we think about the depression and anxiety, and particularly with the youth in this country, there's so much we have to do to help our population, and technology and innovation is the fastest way to do that.
Fantastic. Thank you for that perspective, Alyssa. And thank you to our audience members for participating in that poll. So let's switch a little bit. Luke, I'm going to go to you with this question first. What do you think is the one health trend that's really overhyped right now? Doesn't necessarily have to be in the food space, but, just from what you're seeing, and then conversely, what's one new trend that you'd really like to see take off?
Okay, most overhyped. I think it's sort of similar to like the biohacking and supplements. There's so much money that gets spent on supplements, and there's really not a lot of science behind most of it, and a lot of medical claims that are like borderline medical claims. It's very unregulated. So that's probably the number one if you just look at like the spending versus the benefit versus the potential harm, for me at least, because most of the nutrition that you need to get, you can get from just like eating a balanced diet, and you don't even need a multivitamin. So I think that's probably, but then people are taking 100 pills and spending all kinds of money.
It's so interesting that you said that because that's probably the one health issue that I deal with. There are so many supplements on the market and I never know which ones to use. And so my first sort of time out of the gate where I decided to buy one, I won't say the name, but the packaging is green. I bought all this stuff and then I'm taking it. It tastes like dirt. That's number one. And then one day I thought, this is just my vegetables shredded up and made into a powder. Why don't I just eat the vegetables?
And it's not like that isn't how your body processes vegetables.
Exactly.
Like the whole, like it's the reason why juicing them doesn't do the same thing as eating them. Like you need the fiber. Your body's going to break it down at a certain speed, and you're just going to get a lot more nutrition out of like a whole real food. So I think anything in health or wellness that promises quick results without any effort, that's probably a bad sign. It's like, just like in life, like most of this is actually like hard and takes time, and it's decisions you make over tens of, multiple decades. And so, yeah.
Is there one that you'd like to see take off that maybe isn't growing so fast?
No, I think there's the reverse is also true. Like there's a lot of good, momentum around the things that matter. So like getting exercise and doing strength training and things like that, eating better, more fiber in your diet. There's definitely stuff that I think that I see a lot of positive momentum. I think the challenge is really just that, to the point, like the incentives are still pretty misaligned. It's still a lot more work than it should be. So how do we make that better? And when you think about like the 70% of the food that people consume in the country is highly processed food that's designed to hijack the way that your body processes it to make it addictive and overeat it, like that's a real issue. And so how did, yeah.
Thank you. Kevin, thoughts on this one? What's overhyped?
Well, I think where Luke is exactly right. I mean, what you're seeing in the world that we operate in is an increase of where beauty lives, a lot of wellness type activities that are all nutrition based, right? So because they're packaged goods, they're easy to sell. And so they are easier to be able to be promoted as well. The thing that I think is important though, is that like a lot of the panelists said, we're not complying. We're not eating our vegetables like we should. We're not doing the things that we know will help us. So having some solution is better than no solution. So even though these things might be overhyped, at least we're getting some other options to help us do better in terms of the way we live.
That's a very interesting perspective. What about the trend that you would like to see take off? Anything?
I won't promote what, would be obvious. No, but I think that generally just mental health, as was mentioned, and how mental health is integrated into all of the things that we do in life. It's not just the therapeutic aspect, which is obviously very important because that was the one that wasn't being addressed by folks that look like me in particular, would not indulge in using mental health tools or getting services. So having access in a different way is definitely an important one, and really like to see that continue. But there's other ways to also address mental health as well. How we look at bundling products together so that people will consume them, will indulge in the services that are available. I think that's an opportunity out there for all of us.
So one of the things that, whether we realize it or not, that we're all dealing with even this week is this issue of climate change. I mean, yesterday it was almost 80 degrees. Today I come outside, it's 40 degrees, but I keep hearing that climate change is not real, and I recognize that that's the opinion of some, not the opinion of all, but quite honestly, climate change is probably the biggest issue where we need innovation to solve. And it's not just about the health of the planet, but also about the health of our people. So I'm wondering how you all think climate change is affecting our health. And why don't I start with you, Stephen, and then just come down the line?
It is affecting people's health. You just look on a population level, which you can probably speak to better than any of us, in terms of, what the rise in chronic disease, everything from water quality to air quality to, and you see it in people showing up in emergency rooms, you see it in chronic disease rates that can be tied directly back to climate issues. So it's not really a question of when or whether it'll affect health. It is negatively affecting health, and I think since you are like the public health guru here, I'm hoping that when we get down the line, you've got a solution for it.
Exactly. So
How's
should we
that?
just
The
throw it to
panelists
her right
turning
now?
it back on the moderator.
I think it comes back to a lot of what we look at in our world is behavior, how people live, what they do, what they don't do, and if there's the crazy weather that we experience in Chicago and elsewhere, then some of the behaviors that we would like to have people do. Like everybody was excited about being outside and getting active and doing the things that can help them be healthy, just walking to get coffee instead of driving the 5 blocks to get coffee, whatever it might be. But now the weather changes and we change back to a different behavior. So I think that's one of the things that we certainly would see as a negative impact of climate change.
Anil?
Rather than focusing on climate and the implications of climate change, I wanted to take a step back and maybe throw out a bunch of PSA.
Here we go.
How many of you have a primary care physician, right? Okay, it should be 100%, right? So diagnostic, screening tests, supplements was mentioned, chronic care conditions. All of this kind of leads to you taking control of your health care. And ideally, you should have a primary care physician, PCP. And I did bring up value-based care, right? One of the key principles of, let's say, Medicare Advantage is annual wellness visit. When was the last time you took your blood pressure? Right? So I mentioned chronic care keeps being mentioned. Uncontrolled hypertension is a leading cause of, diseases and stuff, even in Chicago. Simple things like that. We do have tech there. I personally don't take my own blood pressure readings, even though I have blood pressure monitors at home. So I think we need to have a change in how we operate, right? We need to take control of our own health, and not as you age older, right? I mean, you should start early, and one of the good ways to do is primary care. Health systems such as Rush, we do support and encourage people to have their own primary care, even though we do like really great job at fixing people with specialty care, and you might see a lot of advertisements, but we are also pushing heavily, things like food as medicine, getting your, vaccines and diagnostics done, multiple ads on colonoscopy, getting you checked for diabetes and stuff. So at least at Rush, we are looking to, foster healthcare, not sick care, right? So that's a key differentiator.
Anil, just a clarification though, and for the benefit of the audience, a lot of people don't actually know what value-based care is. It's been around for a while, but the name is new. So, since you're talking about it, explain to our audience what value-based care actually is.
Yeah, so basically in healthcare, from a health system perspective, and of course the payers also look at it, is there's two models. One is fee for service, right? Where you go to a doctor, it's transactional. So you go to a doctor, you get paid certain amounts. If you increase the number of visits in a hospital, your revenue goes high. It doesn't mean the outcomes for your patient are good. So there's this model that's primarily pushed from the feds. It's called value-based care, which kind of fosters a team-based approach and outcome-driven payment. You don't get paid like if you make 2 visits, you get paid based on an outcome, like your blood pressure readings goes down, things like that. So it's more about, people having healthier lives. So that's the North Star for healthcare, but that's more of a system problem. You shouldn't be focused on that, but I just wanted to bring that.
Now we can go back to climate change.
Okay, I'll bring us back. So you asked 2 questions. Is it important, and what does it mean? And the first answer, absolutely. Climate and health are absolutely interchanged and connected with each other. We're thematic investors, so we spend a lot of time not only on our main thesis, but sub-theses. We actually present those to our strategic limited partners, again, health systems, health plans, pharma employers, and we did a whole quarter focused on this is what's happening with climate and health. And so to say that this, I think a rhetoric to say it doesn't impact health is an ignorant rhetoric. What does it mean? Many of the panelists, I think, gave a really good outline of some of the externalities, right? Our quality of our water, the quality of our air. Ask anybody who has COPD, they will tell you that climate absolutely affects their health. But there's also the human factors. So there was a study looking at placental babies, so babies before they were born, and whether or not there was microplastics in the placenta. Guess the percentage that had microplastics.
I'm afraid to ask.
100%.
Wow.
They did not find a single placenta that didn't have it. And so you think about the choices and the decisions that we make every day. And we have gone kind of full swing on one side as a society of ease and convenience. But what that's done to our environment, what that's done to our health has really plagued us in a way for generations to come. And so, I think it's our job for the next generations to try to swing that back. We can't undo, some of the forever chemicals. We can't undo things that, will now forever be introduced into our environment. But what we can do is try to make some of the daily smarter choices in order to not only improve our own health, but to improve the health of the next generation.
Thank you. Go ahead, Luke.
Well, I hope some innovator comes up with ways to undo those things. That would be a good idea for the future. But I think environment obviously affects health. I think specifically When I think about climate change impact, the healthy things that I'm encouraging everyone to eat grow in a very surprisingly small number of places. So if you look at like the actual geography of where you can get like lots of fruits and vegetables on a consistent basis, there's not a lot of places in the world that you can do that. And climate change is really stressing those places and shrinking them. And so the end result is that fruits and vegetables and other healthy things get more expensive or completely unattainable. And so you actually go back in time. So I was saying like supplements are not that useful today. There was a period in time where like you absolutely needed supplements because your diet was so concentrated and seasonal that like you had major nutrient deficiencies. And so if you get back to a place where you can't get healthy food year round and you can't get it at a cheap, low cost price, it's going to really disproportionately impact people who have for most people, the average income, like the money that you're spending on food is one of your biggest items in your budget. So if we shrink the space, we increase the cost, we make healthy eating harder, and that would be really bad.
Thank you. And I think, just to sort of sum it up from a public health perspective, I think a lot of what we are seeing with climate change has to do with our behavior. We've become a culture that is so accustomed to convenience and having everything at our fingertips that we don't actually think about how that convenience actually comes to us. So, Kevin, I think it was you that mentioned, driving a block or two to get that cup of coffee or whatever it is you want. But, emissions from gas and other just behavioral things that we do really do impact our environment, and that's really where issues around climate start. So I think as we all think more seriously about our own personal health, I would challenge us all to think about the other activities that we do that create environmental hazards. Back to Alyssa's point around microplastics and things like that. The more we create environmental hazards, the more we are going to experience challenges with climate change. And none of us in this room will be around to see the full effects of our behaviors and our actions today. It'll be our kids, it'll be our grandkids. So it's imperative on all of us to think about those things. So a little bit more targeted, Anil, I'm sorry to say, but you kind of stole a little bit of your own thunder with this next question. But really interested in hearing your thoughts around what would it take to transform a health system from one that's sort of based on reaction to one that's based on prevention?
I think it's happening, to be honest. Just the way like society transforms, like the demographics, like we have younger people, direct to consumer, more informed, right? Health systems have to change. You can't be like, just to take a step back, when you think of hospitals in like, 20, 30, 40 years, you would envision these giant structures that would be somewhere in the middle of downtown. You would drive there, that was like inpatient care, like people like, okay, you go to a hospital to get admitted, But over time, things have transformed people's choices, more choices to consumers and patients, right? They look at like their own testing and stuff. So health systems have been evolving over time. So I'll give you an example of Rush, for example, right now. So our CEO, if you have not heard him, you should. Real a force of nature. He's an ICU doc. One of the things he shares is that as a country, US is spending a lot of money on end-of-life care. If we can shift some of that spending to earlier, like prevention, detection, people are going to live longer. And same with like, equitable care. I mean, things of like social drivers of health, like housing, food, transportation. If we can, address some of these are like public health problems too, right? And people just need to live, a better life. I mean, I'm not saying just a long life, but just a better life. And it's a responsibility of society, not just health systems. We are in this together. But health systems are changing. And I did bring in diagnostics and screening. I mentioned cancer. It's happening. We foster early screening, early detection, so that things are caught early, so that we can address some of the clinical challenges early and get better. Basically.
I love the fact that you mentioned doing things to combat the social determinants of health. And I would say, and I'd agree with you, that Rush really has been a leader here in the city around addressing social determinants of health, engaging community organizations and even private sector business to help do things that will help the environments in which our residents here in Chicago live be healthier and be more accessible. So thank you for mentioning that. Alyssa, I'm interested to hear from you. Considering where you sit as Seven Wire Ventures, what health-related problems are you seeing startups begin to tackle today? I know you've talked a lot about mental health and the need for more innovation there, but just interested in what you're seeing, what you're really excited about that these startups are starting to tackle, and let's hear what you have to say there.
Sure. So I mentioned our thesis is the informed, connected health consumer. So what does that actually mean? It means let's give people access to information, connect them to the system, have the system connect back to them so they can improve their own health outcomes. And we talk about the journey from sick care to well care. And it's all of us, it's our job to know what to do that for ourselves, but not to do that alone, to do it in conjunction with the incumbents, with the providers, with the healthcare ecosystem that has been built. But at the end of the day, for us, if a company is not really thinking about how all of you in this room, how they would engage you and empower you to be better stewards of your health, we just don't think it's interesting. Why? Because we don't think it has the biggest impact, we don't think it has the biggest outcome, we don't think it has the biggest exits. And again, we are a financial investor. We are not a nonprofit. Again, our job is to return lots of capital to our limited partners. And we think the best way to do that, to drive the biggest exits, is to engage people. And there's so many kind of areas of opportunity as you think about, we talk about mental health, we talk about the aging population, particularly aging in place, neurodegenerative disorders. We've learned so much about Alzheimer's and dementia in the last decade. Things like the importance of sleep. When I was coming up in my career in business school, it was like a badge of honor if you slept for 2 hours. Like, that's so dumb. and it will affect you in the end of your life. And so, you think about just the small things that we do today, the preventative health, the diagnostics, that we can go further, connecting women's health. Women's health is not just maternity and having babies, where, maternal health care is so important. And, we look at 4 in 10 babies in this country are born in Medicaid. And so, but it's about the healthcare system wasn't designed for women. Clinical trials weren't designed for women. That, women have heart attacks very differently than men. Cardiovascular disease is rampant amongst women, but it doesn't present itself as the same symptoms. And so there's so much opportunity. Like I guess I turn the question, we're like, I will have a whole lifetime of investment opportunities because, unfortunately, because of the problems that we face. But we love entrepreneurs that say, like, I lived this problem, I see this problem, and I believe that I can fix it, and this is how.
Yeah, I agree with that. And what I'd like to see is, because I was actually just reading a study today about women and how women experience heart disease very differently than how men experience heart disease. What I'd like to see is medical schools actually partnering with innovation hubs like Matter, investors like Seven Wire Ventures, to really kind of retool how these certain conditions are taught to up-and-coming physicians so that they recognize some of these differences and can really help sort of pave the way for these new innovations. And
the believability that, this happens with women, this happens in racial diversity, where people aren't believed with their pain, or how they're presenting might not present in a traditional format. And so a lot of that does come with education, both on the consumer side, but also on the provider side as well.
That's right. So similarly, and Stephen, I'm going to come to you for this question. As I mentioned at the top of our program, Matter has supported over 1,000 healthcare and life sciences companies, or startups, I should say. What patterns are you seeing in the space with startups that are going on to make a real impact?
Yeah, well, So one thing, just a comment, I mean, that you're just talking about, which is sort of good news for entrepreneurs, is that it doesn't really matter what area of healthcare you dig into, like a process, a system, a disease state, whatever it is, it's once you dig in enough, it's totally screwed up. And so there is so much opportunity for entrepreneurs to improve, to develop things that can improve health and improve healthcare. The challenge, and I kind of alluded to it before, is that the hard part isn't the technology or the solution that can solve the problem. It's doing it in such a way that fits within the kind of economic structure of our healthcare system. And so, so two things I would say. One is the successful entrepreneurs are just they're just obsessed with customer insights, with customer discovery, with getting close to the market, with like doing that early and often and regularly, and they're living this this contradiction where they have enough hubris to think like, hey, this is messed up, and this part of the world is messed up, and I'm the one who's going to fix it. Like, that takes a certain amount of hubris, but they're also, at the exact same time, they're humble enough to understand that there's so much that they don't know, and they just need to like sponge up this information and constantly adjust and refine their what it is that they're doing in response to new information that they're getting every day. And then kind of a similar vein is when what they're really obsessed with is solving a particular problem rather than being obsessed with their solution or their technology or their whatever it is, because most of the time what they start out doing is not going to be what they end up doing. It's going to keep evolving and adapting because they're going to keep learning more information and more information and more information as they go, and they'll get better and better at solving that particular problem. And a lot of times, unfortunately, we see entrepreneurs who get stuck because what they're really focused on is their solution and how do they optimize their solution, and if they just do this to their solution, they just do that, and they're missing this whole thing where that's not what the market actually wants. And so you know, I mean, it's complicated. If I knew the exact answer to that, I guess I would say, you know, I'd be leaving here in my, you know, private jet. But
perspective
those are
is
some
important.
patterns.
Perspective is important. That, you know, I think a lot of times we do see entrepreneurs get bogged down, but you have to sort of come up for air at times and pay attention to what the market is demanding. Alyssa?
It's interesting because in business school they talk so much about product market fit, right? And what that means and looking for it, and you read all the blogs about it, and many of you who are entrepreneurs are, you know, sort of become maniacally obsessed with trying to find it. But what no one talks about is founder market fit, right? Why are you or your team the right people to do this? And so going back to the root of understanding the problem, people jump through that. They actually don't, and so some of the best founders, and you know, one of my partners at 7Wire, Glenn Tolman, founded a business called Livongo, and it was started with focusing on type 1 diabetes, expanded into chronic conditions, but his son was diagnosed with T1D. And he was like, is this what happened? Like, this isn't gonna work, and I have to fix this, right? And so the lived experience that so many of you have is, you know, don't underestimate that, plus the exploration of problem solving, because that is often what leads to solution, not I built this super cool technology, everyone go look at it.
So back to the audience. Now that you've heard us talk a little bit about technology, here's a question for you. Do you believe technology will significantly expand human lifespan? Wow.
Go ahead. Yes. Yeah. Wow. Yeah.
Okay, so we're right at about half of our audience having responded. I don't know how much the results here are going to change, but I think it's safe to say that most people think that technology will significantly extend human lifespan. So that's good news for all of us on the panel. Good news for those of you in the audience who are entrepreneurs and innovators.
Can I argue though? Like that's
Yes.
actually not. Lifespan is not good news. Health span is good news. Like just living longer, but spending the last 20 years of your life in extremely poor health is not a good life.
Agreed.
And so I hope that technology, which I actually think we've seen way less of, lifespan we've seen. There's amazing innovations, amazing technologies coming with med devices and such. But I hope we see a lot more that technology does to influence health span.
But I think that's a great distinction, as you put it, health span versus lifespan. We don't typically think that way. So thank you for that distinction. Okay, so I have two more panelist-specific questions to get through, and maybe we'll have a few seconds for rapid fire after that. But Kevin, I want to go to you because you operate in a very interesting space. You could say it's beauty. You could say it's health. Actually, you could say it's where beauty, health, and innovation all meet. How about that?
That's great.
How are
Write that
you?
down. Make sure. You got it.
How are you innovating to make beauty and health complementary?
Wow, great question. So when we founded our business, we knew, let's go right back to it, and I was joking with you, Anil, when we were talking at the beginning about cancer, because actually nobody really wants to talk about cancer, especially in the beauty industry, and especially when it comes to skin cancer. And we know how prevalent skin cancer it is. It is the most prevalent cancer, most highly diagnosed form of cancer. And it's one of the most preventable. It's just the way we live our lives, the lack of using the products that we could use, the lack of protecting ourselves from UV damage is something that we all can do, and we could all address that particular cancer starting tomorrow, right? And so part of our goal was, we know we can help people through helping them to want to use the products that we have. I think there's been a lot of conversation around consumer-directed behaviors, which I think is an important part of what we need to see to address improving health span. And so our idea was build products that are beautiful, that people want to use, all types of forms, formats, that will actually help improve their skin health over time. And so that was really at the heart of what we did. You had to innovate to achieve that, but that was really, still is at the heart of what we did and still do.
I love that. Thank you for that.
You're welcome.
And last but not least, Luke, one panelist-specific question for you. And you started to allude to this earlier when you were talking about healthy foods and really intaking food in more of a natural state. But what would be your thoughts around how we make the healthy choice the easy choice, rather than looking for shortcuts, and at scale, I would add?
Yes. So obviously I've spent a lot of time over the last 13 plus years thinking about that. And I think in consumer world, it's really simple. If it's what's cheaper, easier, and like tastes as good or like meets the need at the same level. And so that was kind of the whole premise behind Farmer's Fridge, was like, I was like, people want to eat healthy. I mean, look at the survey response. Like, this is something people want to do. It's just pretty hard. It's more expensive. It doesn't taste as good. Like, fix that. And so I think on any of these problems, whether it's mental health or how you eat, or just like, how do you make it easier for people? Rather than saying, oh, you should eat healthier, just don't even think about it. Like, this is actually cheaper and it's right here next to you. And so then people just are, it's easier to make a better decision. I think one of the things I've learned along the way is there's a like a biological chemistry component to that, where you've been hijacked to like want something really salty or sweet, and so now there's a lot of technology, GLP-1s being the one I think about the most because it affects the food industry in a big way, but where you could actually like see how you can take control back into your own hands and not have as many cravings and things like that. So I'm very optimistic. I think the combination of science and then people working to solve these problems and make them less expensive, more convenient, whatever that may be, so that more and more people have access. So things like telehealth or exercise programs that you're going on ChatGPT and figuring out what to do. And I think all of that is very positive and will continue to be a trend that helps people get healthier.
Fantastic. Well, thank you for sort of ending us on that note. So as we prepare to close, we have 2 minutes left. So I'm going to do, what's a panel without a few rapid fire questions at the end, right? Okay, so for each of you, I'm going to ask you to respond in 1 or 2 words. First question, 1 word that defines the future of health. Luke.
Better? Probably.
Okay.
Empowered consumers.
2 words, I'll take it.
Okay, thanks. I break the rules law.
Anil.
Longer.
Longer, okay. Kevin.
Hopeful.
Ambient.
Ambient, okay. If we had time, I would ask you to expound, but that's okay. You guys, if you're wondering, just grab him afterwards. Okay, 1 habit everyone in this room should start tomorrow. Stephen, go.
Talk to a stranger.
Okay.
Use your sunscreen.
How did we know, right?
Take charge of your health.
Walk.
Sleep more.
Yes. Okay, final one. 1 thing you've personally changed your mind about when it comes to health.
I used to think like just calories were the same all going in, and I think what I've learned is that's not the case. Sorry, that's more.
Awesome. A lot of rule breakers on this panel, as you can see.
I'll stick to the rule. Sleep.
Okay. Anil?
Yeah, going to the doctor.
Walking is good or better than running.
Okay. Now you tell me, after I spent all those years running.
Well, I take a lot of supplements, but I think they're all totally useless.
I have to say, I love a panel that's both informative and comedic at the same time. So, ladies and gentlemen, please join me in thanking our panelists this evening. And with that, we'll welcome Luke back to the stage.
Thank you. And a round of applause for Suzette, our moderator. I agree. Informative and fun. That's the best combination. That's the best way to learn. So thank you, all of you, for sharing your insights, your expertise. Thank you, all of you, for being here, being part of the Chicago Innovation community. If you enjoy conversations like this, hopefully we'll see you at some of our other events. Our AI plus IQ event is next on April 29th. Join our mentoring programs or Chicago Innovation Fellows. Applications are all open. And most importantly, I'm going to build on what Steven said at the end, which is there's a reason why we do this in person and not just over, the computer screen, is because we want all of you to meet each other. Meeting people is the best way to learn new things, to gain empathy, to develop collaborative partnerships that can launch great stuff in Chicago. So please spend time. We make it easy to meet each other. There's alcohol. There's also non-alcoholic wine too. So we're covering all of our bases tonight. There's food, and definitely check out all the exhibiting expo partners. Get some food from Farmer's Fridge. Try some products from Solésence. There's lots of great things out there. Enjoy the rest of the evening, and we hope to see you again.